Insight. I am here with Dr. Ron Cohen at Cohen Orthodontics, and we're going to talk about, I thought it was new, it's probably not really new, but back in the day when I had the braces done, you just had your braces, that was it, you know. But now there's two-phase treatment. I guess first tell me what two-phase treatment is.
Right. Well, let me give you a little history. In the United States, for many years, we used mostly fixed appliances, braces, right? Braces work well when you have permanent teeth in. They're not really designed to be used on baby teeth because, you know, directing baby teeth into a perfect position doesn't necessarily guarantee the permanent ones are going to come where they're going to come in. In Europe, starting probably in the late 40s, early 50s, most of their work was done prior to having all the permanent teeth in. Early treatment using removable appliances for expansion and for jaw structure growth, at least that's what the goal was. And a lot of that was due to the fact that with the socialized dental care system that they have there, they wanted to do things as cheaply as they could and get as good a result as they possibly could without going all out and getting the best result that you can. Not a political statement, although we'll talk about that later. But in the United States, we never did that. So we've kind of married the two together, and I've been doing that for probably 20 years, to where we look at our patients when they first come in, when they're young, 7, 8, 9 years old, and look to see if they have significant bone structure differences. Jaw width relationships, jaw length relationships, huge overbites, underbites, crossbites, big crowding problems that if you don't do something to try to get them going toward the right direction, then you have to condemn them to, number one, having teeth taken out virtually all the time, using headgears, which I don't use hardly anymore, doing things that you know, most of us that have had orthodontic treatment. I was going to say, you're going through everything I had done. Teeth pulled, ugly headgear, Exactly. So in many instances, if you can find someone, and there are some guidelines as far as which cases will work out best if you treat them early and then treat them late also, or whether you just wait and do it all at one time. So those that have severe arch narrowness to the upper jaw develops early, age 1, 2, 3, 4, 5, by 5 or 6, maybe even 7 years old. The width is already formed, and then the lower jaw has to grow to adapt to that. The lower jaw then starts growing more than the upper jaw does as you get into puberty. So if your upper jaw's not in the right place, if it's not the right width and you don't have enough space up there, then there's no way the lower jaw is going to fit, and then you end up having to make your teeth fit a jaw structure that doesn't fit. The goal with two-phase treatment is to orthopedically make your jaws fit first, and then once all the teeth are in, then orthodontically make all the teeth fit.
Okay, that makes sense. What kind of, it's not pulling teeth and using that big ugly headgear, what kind of appliances do you use in that first phase then?
There are a variety of appliances to use. Really, it's more goal-oriented than anything else. I first look at the widths of the jaws, and we use different types of appliances to widen the jaw structure. Then as far as lengthening the jaw structure, if you have an overbite where the lower jaw is back, there's appliances that we use to help to grow the lower jaw forward. A Herbst appliance, which you'll see in the movie that's attached here. There are some times that I still do use a headgear. It's very rare, but it's the ones where you have an underbite difficulty, where you have to try to bring the upper jaw forward, and the only thing that you have to pull from is your forehead and your chin. That's the only anchors that you have.
Or you put it on the wall in front of you, and that doesn't work so much.
It's not very pretty doing it that way either. But the whole idea is to try to equalize your jaw structures as early as you can, and the whole idea also is to help stimulate growth in areas that you need the body to grow.
So if somebody comes in and you say, okay, yes, two-phase treatment, we're going to do this right now, are there sometimes instances where that second phase becomes unnecessary?
There are, especially ones that come in where the first part is not going to be super difficult. It's really more of a width and space problem than it is a length problem. Those, about 25–30% of them, don't need a second part of treatment. Unfortunately, that's more luck than it is skill, because there's so many variables involved with it. You know, the goal of our first part of treatment is to make sure we have the proper width and make all the space we need and get the right overbite. And if we can do that, Mother Nature's got a chance of filling in the blanks a lot better. But there are times that Mother Nature just doesn't do that, that a tooth comes in rotated 90 degrees or something comes in a crossbite that's not supposed to. There's so many variables involved with it that you can't predict that. But What you can predict is that if you have a successful phase 1 treatment plan, your second part of treatment is going to be much easier, much simpler, and much quicker than if you had let it go and did nothing until all the teeth were in. Then it becomes a real hassle, and you end up being in treatment, from 6th grade until you're a senior in high school.
It's no fun.
No, it's no fun.
Are two-phase treatments more expensive than a single phase?
There's more work involved with it, obviously. In my practice, when you add up a first and second phase treatment versus waiting and doing it all at one time, the negative is that it ends up costing you about 130% more to do it in 2 phases than it does in 1 phase. The positive is that in most instances, you don't have to pull 4 teeth. You're not in braces for 3.5 or 4 years. You have a much better smile relationship and usually much better balance to the facial structure. So the benefits, in my opinion, far outweigh the little bit of additional cost that's involved with it. There are some people that say, you know what, I don't want to pay more, just do the best you can. Well, you do the best you can. But as long as people understand that what's going to be best for them long term, for the next 60 to 70 years, sometimes you have to invest a little bit more to get to that point, but when you amortize it out over those 70 years, it's nothing. It really is nothing.
What about somebody who's at home watching this and they have a 7-year-old? Is that too early? At what point do they say, okay, things don't look great, I should come see Dr. Cohen?
Yeah, most of my patients will come in at age 7 to 8 years old. In fact, the American Association of Orthodontists says that we should see a person at about age 7. Especially those that are thumb suckers or mouth breathers. There are a lot of environmental influences that cause the teeth and jaws to grow into really weird positions. The sooner that we can get in there and try to reverse that, the better chance we have of reversing the growth pattern. But there'll be a lot of our patients we see at 7, 8 years old. If they're ready, I'll say, you know what, you're ready. If they're not ready, then I'll say you're not ready. I treat all the patients the way I do my own kids, and I've got enough kids that have been through orthodontic treatment that if it's necessary to put them through the extra treatment, we will. If it's not, we won't do that. There's no reason to put them through more treatment than they need to.
But you are the professional, so probably you should be the one that says, yes, you should start now, or no, you shouldn't. I, as a parent, I probably shouldn't take that guess whether or not it's time.
That'd be great if all my parents felt that way.
I'll work on that for you.
Well, yeah, good.
Well, if your child has some things that you'd like Dr. Cohen to see, you just want to check out and see if they're ready for orthodontics, you can give their offices a call. They're both in Fort Wayne and in Churubusco, or visit them on their website. It's open 24/7. You can visit their website at www.docronsmiles.com.